Occupational English Test, Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Michael. Come on in and take a seat. My name is Jean Matthews.
Hello, Doctor.
Well, can you tell me what's brought you here today?
Well, to be honest, I haven't been feeling well for the past week or so.
That's no good. What sort of symptoms have you had?
I've had a fever for a few days. It comes on worse in the afternoons as well. I have been feeling a bit nauseous as well.
And are you taking anything for that? Panadol, things like that?
No, I haven't. I've just been trying to tough it out.
Okay. And what about your eating habits? Have you noticed any change to your appetite?
Yeah, well, I don't seem to be as hungry. I haven't been able to complete my meals without feeling a bit sick.
And with the nausea, has it ended up in vomiting?
Yeah, I did vomit actually, both yesterday morning and this morning. That's one of the reasons I thought I'd better come and see you.
Okay. And what about any other aches or pains generally?
I'm feeling little bit tired, and I've had a few pains in my joints, and I've been a little bit stiff in the mornings.
And have you noticed any other sort of changes, such as yellowish skin or in the whites of your eyes?
Well, I didn't, but my wife commented this morning that she thought my skin had turned a bit yellowish.
And what about the colour of your urine? Any changes there?
Now you mention it, I do think it's become darker in colour.
Okay, I see. Now, Michael, I'd just like to get some background details before we go any further. Could we start with your age, please?
I'm 38.
Are you married?
Yes, I am.
And any children?
Yeah, I've got 2 children.
And how old are they?
I've got a daughter who's 9 and a son who's 11.
Oh, lovely. Okay. And what about your employment? What sort of work do you do?
I'm a carpenter by trade.
I see. And you work mainly on building sites and places like that?
Well, I do work on building sites, but the company I'm currently working for now has quite a few overseas projects, so I do go overseas quite a bit with my work.
And whereabouts have you worked recently?
Well, this year I've been to East Timor, and I've just come back from New Guinea about 10 days ago.
I see. Okay. And just tell me a little bit more about your general health.
Well, pretty fine, I think. I eat healthily, and I haven't had any complaints.
And do you smoke at all?
I do smoke, but I try to keep it under control. I suppose I smoke about 10 cigarettes a day.
Okay. And what about alcohol?
Well, I have a couple of beers most days, but my wife and I are trying to be responsible and have a couple of alcohol-free days each week.
Well, that's an excellent idea. Okay, very good. And now, just to go on to your family history, what about your parents? Are they in good health?
Yeah, they're both in quite good health. My father, he retired a couple of years ago, but he's fine. And my mother, she's well. She does have high blood pressure, and she does take some medication for that, I believe.
Mm-hmm. Okay. And do you have any brothers or sisters?
I've got 3 sisters, and they're all well.
Okay, good. Well, Michael, your blood pressure is certainly excellent, and you're not overweight.
I'm pleased to hear that.
But what I do think, based on your symptoms and the jaundice and everything you've told me, I'm a little concerned that you might have hepatitis A.
Really?
Well, this is not something to be greatly alarmed about, but it may be connected with your overseas travel. It's spread through fecal-oral transmission, and it may be that you've touched something and that's been contaminated, for example.
So you think I might have picked this up on one of my overseas trips then?
So yes, it's very possible. When you travel, do you eat the local foods?
Well, actually, because I do travel a lot, I am aware of the risks, and I'm very careful with what I eat. I try to only eat food from the hotel, and on this particular trip I didn't eat out in the marketplace, and I always drank bottled water.
Okay. Well, look, I'm sure you did take proper precautions, but even when we do this, it's still quite possible. Sometimes the hotel staff may not have practiced the level of hygiene required. They might have touched utensils or food that you've eaten, and that's how this can be picked up. So,
I see. Well, this is a real nuisance for me, Doctor. If I've got this hepatitis, what can I expect to happen now?
well, the first thing we need to do is confirm this diagnosis, and for that you'll need to take a liver function test.
I see.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase.
You hear a senior obstetrician talking to a patient called Hilary Johnson, who has been referred by her midwife.
Hilary Johnson? Hi. Do come in and take a seat. I'm Dr. Smith, and I'm a senior obstetrician here. So, Hilary, you've been referred to us by your midwife.
Mm-hmm.
I have her notes with me here, but could you tell me in your own words why you've been referred?
Oh, yeah, no problem. I think I've been referred to you because the midwife said she found some glucose in my urine sample and was worried about diabetes. If I understand correctly, I could have diabetes during my pregnancy, but if I do, it's not likely to continue after giving birth. I've noticed that I'm craving sweets and cakes all the time at the moment, and I've just been letting myself eat whatever. So I've put on a bit of weight, and I don't think it's all just baby weight either. I've never had a problem with diabetes before, and I'm hoping it'll turn out to be something else. My aunt actually has type 2 diabetes, but she's always eaten a lot of sugar, so I think that might be a factor. She just controls hers with diet now and doesn't have to take any medication.
Oh, okay. Thanks for letting me know. I see from your notes that you're 24 weeks pregnant now. How has your pregnancy been up to now?
Oh, I have been so lucky. I got the usual sickness early on. Well, stomach pain, but not actually being sick. I think that's pretty common. And it's settled after the first trimester. I've been taking some medication because I also had pretty horrible heartburn.
Right.
And it seems to take care of the problem. And also I've started to get a bit of back pain in the last week or so. I'd say it's like a throbbing feeling, but other than that, I've been pretty fortunate. I suppose I've been gradually getting more and more tired since the start of my pregnancy. I've just put it down to the extra energy my baby needs. But it could also be because I haven't been sleeping very well. Also, sometimes the nausea stops me from making something healthy for dinner. which is annoying because I know I need to eat healthily. I take a prenatal, though, to make sure I'm getting the right nutrition.
Well, it seems like you're managing to deal with most of your symptoms well.
Yeah, this is my first pregnancy, and to be honest, I didn't have a clue what to expect, but so far so good. It's only this glucose thing that's got me worried. I imagine it's just a one-off, but I guess it's best to get it seen to.
Certainly, and I'm pleased you're here so we can get things sorted. So we'll need to book another appointment to carry out some tests.
Okay, so when will I have to have this? Because I'm a bit busy at work at the minute.
Well, ideally as soon as possible. Can I ask what you do for a living?
I'm a high school teacher, and it's just getting to that time of year when the kids are gearing up for their examinations. So I can't afford to be taking too much time off during the day. I'm actually a little bit stressed at the moment as well. I've had to do a lot more work over the past few weeks. I think it's just that time of year. I've been a teacher for 4 years now, so I'm starting to develop ways of coping with the madness. With that in mind, if our next appointment could be at 5-ish or later, then that would be perfect.
No problem. Just make sure to let the receptionist know your preferences. When we find sugar in preliminary tests, we offer an oral glucose tolerance test, which is what we'll do when you come in next. Do you know what that involves?
Well, I asked a few of my friends about their pregnancies, and my friend Beth said that she had the same thing and told me about that test. She said that she had to come into the hospital and drink a sugary drink and then have a blood test to tell if she had diabetes. Is that right?
Yeah, that's pretty much it. Here's the leaflet that explains the test so that you can have a read about it when you get home. Do you have any other questions for me?
No, I don't think so. I'll go away and read this and wait and see what the test says. Well, thank you for your help today.
You're welcome. I'll see you once we have the results and we can take it from there.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
You hear an ED nurse talking to the relative of a patient who has been recently admitted.
Did you want to talk to me, Miss Tanaka?
Oh, yes. You see, I just wanted to let you know that my father, well, as you know, he's recently been diagnosed with dementia. Most of the time it's not an issue and his spats never last long. It's just that I wanted to prepare you. Sometimes he's really not himself.
Okay, Miss Tanaka. I think I understand. Can your father become aggressive?
Yes. I mean, I think it's just that he gets frustrated sometimes. He can't remember things, and I think it's scary for him. He was never, ever like this before his dementia, and those periods, well, they really don't reflect his true character.
Of course. Thanks for letting me know.
You hear an obstetrician describe a Caesarean section to a pregnant patient.
Labour can progress differently for different people. In some circumstances, if labour is longer than expected, and if we detect that the baby is distressed, then we may have to consider an emergency caesarean section. It's a procedure that we perform in theatre, and it is carried out under spinal or epidural anaesthetic, so that you don't feel anything, but you will be awake. A screen is placed across your body, so you don't have to see what's being done. We make an incision in your tummy and womb, just under your bikini line to remove your baby, and then stitch up the wound. It takes around 40 minutes, and your birth partner can be there at all times. Does that make sense?
You hear a GP and his practice nurse discussing their yearly schedule.
In September, we'll have a lot of new patients as the first-year university students will all register during freshers.
Yes, we were really run off our feet last year, weren't we?
Yep, it was a madhouse.
Do you think we should hire agency staff to help out for the first couple of weeks this time around?
Well, I think part of the problem was that last year Dr. Igwe and Nurse Fletcher were both away. Dr. Igwe went to Costa Rica and Nurse Fletcher had the flu.
Oh, right, I remember. Well, we can't do much to prevent staff illness.
No, but we can ask people to avoid booking time off in those first 3 weeks.
OK, I'll send an email out today.
You hear a nurse prepare a patient for a flu shot.
Good morning, Mr. Henderson.
Hi.
Dr. Ray has recommended that you get a flu immunisation shot before you're discharged. I've got the injection ready to give you. Are you allergic to anything?
I'm only allergic to latex and penicillin. I don't know if I want the flu shot.
Oh.
The last time I got the shot, I got sick.
I'm sorry that happened to you. What kind of symptoms did you have after that last flu shot?
I got a runny nose and a headache, and my arm felt like someone punched me.
Sometimes the flu shot can cause reactions like a sore injection site and headache. Other common symptoms include being tired, muscle and joint aches, shivering and fever. All of these symptoms can be seen with the flu, but the shot can't give you the flu.
You hear a doctor talk to a patient about her injury.
Good morning, Mrs. Bowder. I'll be your doctor taking care of your cut there. What exactly happened?
Oh, it's embarrassing, really. You see, I was just trying to chop some tomatoes for dinner and the knife accidentally slipped. Oh, I'm so clumsy. I hope it doesn't hurt too much to stitch back up.
Well, we're going to numb the area now with a shot of lidocaine. You'll feel a poke of the needle and a slight burn, but afterwards the area should be numb and you'll feel nothing during the procedure.
Oh, good.
We should be finished in about 10 minutes.
Good. How many stitches will I need? And how long will they have to stay in? I'm really conscious about my hands, so I hope I don't have a scar.
I will only know for sure once I finish suturing, but by my estimation, you might require at least 4 to 5 sutures.
Oh.
They'll have to stay in for 5 to 10 days, and you'll need to come back in to get them removed.
Right.
I'll do my best to try and line up the edges to create as little scarring as possible.
Thank you.
But I can't guarantee there will be nothing there.
You hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease, or COPD.
I haven't treated anyone with COPD before. What would we need to do differently?
One of the most important things would be to make sure to prescribe oxygen at levels between 88 to 92%.
Okay, so why would that be necessary? If he's having trouble breathing, shouldn't we prescribe higher oxygen levels? Most patients receive oxygen at levels between 94 and 98%.
Well, in healthy individuals, a rise in carbon dioxide would result in an increased drive to breathe in order to eliminate the excess gas.
Right.
However, in some patients with COPD, this response is blunted, and their main mechanism for respiratory drive is controlled by the level of oxygen in the body instead. If the level of oxygen given to a COPD patient is increased too much, it can actually reduce the stimulus to breathe and cause hypoventilation, resulting in an increase in CO2.
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
In this part of the test, you will hear a talk based on an essay published by the Public Library of Open Science on the topic of global affordability of fluoride toothpaste.
The carcinogenic potential of diet emerges in areas where fluoride supplementation is inadequate, such as in many developing regions and countries of the world. There's no doubt that dental caries is a global health problem and has a significant negative impact on the quality of life, economic productivity, adult and children's general health and development. What is worse, untreated dental caries in preschool children is associated with poorer quality of life due to the discomfort and difficulties in ingesting food, and this can result in a failure to gain weight and impaired cognitive development. This situation can be very distressing for families, and regrettably, since low-income countries do not have sufficient funds to afford dental restorative treatment, combined with the fact that they are most vulnerable to the impact of illness, then it's fair to say that they should be afforded a greater degree of protection. By World Health Organization estimates, 1/3 of the world's population have inadequate access to needed medicines, not because of education levels or location, but because they cannot afford them. Despite the inclusion of sodium fluoride in the WHO's Essential Medicines Model List, the global availability and accessibility of fluoride for the prevention of dental caries remains a global problem. Now, the optimal use of fluoride is an essential and basic public health strategy in the prevention and control of dental caries, because dental caries is the most common non-communicable disease on the planet today. Although a whole range of fluoride vehicles are available for fluoride use, such as drinking water, salt, milk, varnish, to name a few, the most widely used method for maintaining a constant low level of fluoride in the oral environment is fluoride toothpaste. Equity pricing is another method of reducing costs. It's based on the principle that the poor should pay less for effective medication and have better access to effective medication. The price of fluoride toothpaste should be fair, equitable and affordable, even for poor communities. Moreover, the same brand of toothpaste should be available at different prices in different countries, in accordance with the people's wages and purchasing power. Expensive ingredients and packaging is another area where costs can be reduced. Approximately 40% of the cost of production of toothpaste is related to the enclosing or protecting the toothpaste for distribution, sale and use. Another 35% is attributed to the ingredients, and the final 25% can be attributed to manual work involved in manufacturing the product.
Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
When dealing with new patients or patient referrals, you need to ask not only what medication they're currently taking, but why they're taking it. Many doctors assume that patients understand the reasons for their course of treatment, but some patients may have been prescribed these drugs a long time ago, and despite their prior doctor no doubt outlining the reasons why such drugs are needed, patients can forget or misremember the actual reason why these prescriptions are necessary to them. Make sure you go through this at the earliest convenience. So a good way to start these discussions is to ask, can you tell me what you're currently taking and what it's for?
Today I'm talking to Dr. Chen, a veterinary expert in feline immunodeficiency virus, or FIV. Dr. Chen, what can you tell us about the disease?
Well, FIV is a topic that I tend to discuss quite frequently with my patients. Although lots of people have heard of FIV and know generally that it is a virus that affects cats, there are many misconceptions about the condition, what it means for the cat and what owners with FIV-positive cats must do. Many people worry about catching FIV from infected cats, which is actually not possible, as the disease cannot be transmitted to humans. Unfortunately, this belief often prevents people from adopting cats who suffer from FIV, as they're concerned about themselves or their children contracting the virus from the cat.
I see. And are there any other things that might confuse people about FIV?
There certainly are. There is another virus that can affect cats that people may be aware of, called feline leukemia, or FeLV. FeLV significantly reduces a cat's life expectancy and health. Due to the similarity of the two viruses' names, I found that people tend to mix the two viruses up. So when they're told that a cat has FIV, they believe that the cat is extremely ill and will require lengthy and expensive treatment, when in fact the cat should be able to lead a fairly normal life.
I'm sure many owners will be relieved to hear that. So what advice would you give to the owners of FIV-positive cats?
Well, the virus can deplete certain white blood cells, which means that cats with FIV are often more susceptible to catching other infections, and will often find it more difficult to recover from these infections. FIV is often compared to AIDS in humans, and the two immunosuppressant viruses are very similar. Those with FIV-positive cats should, by and large, treat their cats the same as any other cats. However, these cats should be kept indoors to lower the risk of infection and to prevent them from spreading the virus. Owners should also pay more attention to the well-being of their cat, and if their pet shows any sign of illness, they should be taken to the vet at the earliest opportunity.
As healthcare workers, we always put our patients first. We've recently concluded a year-long survey looking into the level of satisfaction of adult inpatients at this hospital, and I wanted to share some of those results with you all today. I've been doing these surveys for a while now, and let me tell you first off that I was absolutely flabbergasted by the patient engagement level here. Seriously, out of all the patients asked to complete the survey, a remarkable 86% responded, and that may be the highest proportion I've ever seen. More responses not only provide us with more data, but it also suggests that you've created a great environment in which your patients feel comfortable expressing their views. Let's take a look at what some of these respondents felt about the care they received. We'll start with inpatients in their 20s. This group had the highest satisfaction rate of all respondents. Now, that's great, but there are a couple of influencing factors we should bear in mind that might explain why this group was more satisfied with their treatment. The group of patients in their 20s was also the group with the shortest average inpatient stay. The majority of these patients were discharged after less than a week in hospital. As such, this group is less likely to have experienced the frustration and worry that can become more of an issue with patients who have extended stays at the hospital.
That is the end of Part C. You now have 2 minutes to check your answers.